progress.
Okay, good evening, everyone. Just a quick sound check. You can hear me, please type something in the chat box. Okay, thank you, Anson. All right. So tonight, a very special webinar, a very special guest, also different from the usual webinars that we host. Okay, so I won't hold up the time too much, but first disclaimer. I know this is the standard disclaimer when it comes to like most of our webinars, but at any rate, tonight's webinar is really just for sharing. If you really have any health issues, please consult a medical professional. That's what I can say. All right. So about the speaker. So tonight we are very blessed to have Dr. Yuan with us. He kindly agreed to do this webinar just for outreach purpose. He is a senior consultant ENT surgeon with Mount E Orchard, and of course a few other accolades that you can see there. So I'm shortly going to hand it over to him. He will start his sharing session, and then of course at the end, I would appreciate if you have any questions, please hold on to them first, and we will have a short Q&A session towards the end where he can come in and answer some of your questions. Okay, so uh, let's get started. So Dr. Yuan, are you there? Dr. Yuan? Yes. Okay. Hey, hi. Okay, so I'm going to hand it over to Dr. Yuan, who will be sharing his slides, and welcome to his world.
Okay, thank you, Elijah, and good evening,
Thank you.
everybody. Let me see if I can share my slides. Yes. All right. So, as Elijah has mentioned, tonight we are really going to share about hearing. And although not many people think about hearing as part of health, but it is actually a very important part of health. And we're going to explore a little bit as to why tonight, and hopefully by the end of the session, which probably takes about 45 minutes, you will understand more about our ear, hearing, and what impact it has on our lives. Okay, so here goes. So what we are going to talk about really is how hearing impact our cognition. And I think cognition and memory and the brain has been on the news quite recently. And recent studies have shown a very close association between hearing and our brain. So we're going to explore that a little bit tonight. And of course, we need to touch on the big study that quite a lot of these findings have been based on, known as the ACHIEVE study, coming out of Johns Hopkins University in the US. And of course, talk a little bit about what we can do for people with hearing problems, and whether there are any other solutions besides hearing aids that most of us know about. But are there any other things on the horizon, or whether there are new technologies available? So here we go. I think we all know, and I won't belabor the point, that our population is aging very rapidly. And we all know that hearing decreases as we age. And that's a given. The extent to which it decreases really depends on the individual. And a lot of it is actually genetically imprinted in us. But for a person who has significant hearing loss, as I mentioned recently, we have found a very close link between that and early cognitive decline and eventual development of dementia. And from all the studies that have been done in the last 5 to 8 years, it's been shown that correcting hearing loss is really an important factor in trying to slow down cognitive decline and the onset of dementia. the findings have been so compelling that 5 years ago, with the Lancet Commission report and as well as the WHO World Report on Hearing, they were compelled to issue a statement that hearing loss is the number one modifiable risk factor when we are talking about dementia prevention. So it is becoming an increasingly important factor in our fight against mental decline, cognitive decline, and battling onset of dementia in our population. And some of the studies have borne out the fact. So if we looked at the top right picture, you can see the area of the brain that's being stimulated when a person exposed to sound in a person who is deaf compared to someone who has no hearing. The area of the brain that's being stimulated is really utterly different. It is smaller in people with hearing loss, and that implies that people with significant hearing loss will have significant part of the brain that's understimulated. And of course, I think it is intuitive that brain goes lazy. And after a while, as I tell my patients, the brain actually goes to sleep. It's like going around doing things with one hand, the other one tied behind your back. Soon the one that is not being used loses its function. So it's in similar kind of concept. And when people look at the brain, scan of the brain, people with dementia and people with severe hearing loss, they notice that the brain changes are similar. And therefore, the chain of events that give rise to dementia in people with significant hearing loss appears to be the same. And this is again shown in the study that I've mentioned. This is a very authoritative medical journal, The Lancet. And they have shown that hearing loss is an important global health target if we are talking about dementia prevention. And just a very quick word about how the trial was conducted. It's really conducted over a few years in a big population in America. And they looked at the onset of dementia in people who have normal hearing, who are at high risk of dementia, people who have significant hearing loss, whether intervention in them will lead to reduction in the early onset of the cognitive decline. And indeed, for people with significant hearing loss and they were prescribed, for example, with hearing devices like hearing aids, they substantially reduce the risk of cognitive decline. And it again sort of reaffirmed studies that have been done previously, although the CHIEF study is the first one to look very closely at the intervention part of it. Even though we know hearing loss is associated with the early onset of dementia, but the CHIEF study is the first to show that intervening actually reduces that risk. And therefore, it behooves us, until and unless we can identify for sure who is at risk for cognitive decline, I think it is important to treat everybody, especially the elderly, who has hearing loss, so that they can prevent early cognitive decline and onset of dementia. But the long-term question is now being answered in a follow-up to the CHIEF study. What about in those healthy people, young people? If we intervene even earlier, before they reach a certain age, can they then prevent, delay cognitive decline totally? So we are eagerly awaiting the results from some of these trials. But be that as it may, it gets even more serious than that. So recent studies in the last couple of years have shown that not only is hearing loss associated with dementia, it is associated with increased mortality from all causes. So among people with hearing loss, they have a higher mortality when you, even though you adjust for age and you adjust for other medical conditions. And if the people with hearing loss actually use a hearing aid, they actually again lower the risk of mortality for many different causes. And again, it is not difficult to understand because when a person has hearing loss, there are a lot of ramifications. For example, dementia, social isolation, and a lot of people with hearing loss also have dizziness, they end up with falls, and a lot of associated medical problems. So the big question, of course, is what can we do for hearing loss? And really, like most things, prevention is very important. And this is part of what we are doing, promoting awareness and education for people. Because hearing loss, I call it a silent pandemic. Because if you have hearing loss and I look at you casually, I may not notice. But in contrast, with people with, for example, visual impairment, I think it's quite obvious. So quite often, hearing loss is neglected in our population. Treatment, the awareness is not there. People tend to have delayed treatment and they suffer for it. So therefore, it's important to be aware and also go for regular health screening. And now hearing is part of a lot of screening packages. And it's important to get our hearing tested at some point to know what is the level. Especially if you have a family history of hearing loss, or you have a history of noise exposure or loud noise exposure in your line of work, or you enjoy loud music, it's important to get your hearing tested. And people who get infection, for example, people who swim a lot tend to have increased risk of getting ear infection. These are also the people who need to be very careful about their hearing deteriorating. And once they diagnose themselves with hearing loss, they need to get early treatment and some kind of intervention. And so early diagnosis is very important. Not only allows you to get treated and get intervention in the form of, for example, hearing aids, but it also help you to look for more dangerous things. For example, in this patient of mine who came to me with mild hearing loss, which is a bit worse on one side. We call it asymmetrical hearing loss. And she came to us with also a little bit of imbalance. And we are very concerned whenever a person has a single-sided problem. Because if it's age-related or noise exposure-related, it should be bilateral, right? So when a person has problems only in one ear, we tend to do an MRI. And indeed, in this lady, she's got a tumor of the hearing nerve that is actually quite large and pressing. And all she had actually was a little bit of imbalance, but the main thing was hearing loss. So it is important to get a diagnosis early to make sure and all these things that may be serious can be excluded. But once we diagnose a person with hearing loss, there are many hearing restoration options. And quite a lot of them are reversible. For example, if an external infection, earwax blocking up the whole ear canal, it's a simple matter of just removing the infection and clearing the earwax, and the hearing can be improved. Or it may be an infection that has caused a perforation of the eardrum that can be easily rectified to improve the hearing. And of course, for those who have more significant infection or conditions that affect the hearing of the ear, you can always reconstruct the hearing in very simple surgeries. And for those of us who have what we call inner ear hearing loss, which is usually associated with age or noise exposure, you can see the diagram here. The first lower diagram shows hair cells in our inner ear, the part that is responsible for hearing, otherwise known as the cochlea. These are healthy rows of hair cells. The second diagram here shows how the hair cells can degenerate and the significant loss of hair cells, for example, as we age or we are on some long-term medication, especially a class of antibiotics, is very detrimental to the hair cells. And of course, once the hair cells, which are the very important sensory cells for hearing, degenerate or dies, they unfortunately do not regenerate. And therefore, the only way really is to help the patient improve the hearing with hearing aids or some kind of hearing implants. So hearing aids are the first line and the most common method to improve or restore someone's hearing, and is extremely effective. In the past, I'm sure even now, you may have heard people around you or your friends or your older relatives talk about hearing aids being noisy or very inconvenient, very ugly, very big. But nowadays, the hearing aids have advanced very much in technology and the form factor. So they are very unobtrusive, very small and not obvious at all. And not only that, they come packed with advanced technology like noise cancellation, they have Bluetooth capability, direct streaming. So patients don't even need to pick up their phone anymore. There's direct streaming to their hearing aid. They can hear conversations over the phone very well. And I always try to address some of the factors that are preventing patients from using hearing aids. These are the top 5 reasons why most patients, or rather, they are more reluctant to use hearing aids. Cost is one of them. Of course, some of the hearing aids nowadays that come with a lot of technology will cost more. Comfort can easily be addressed because nowadays the ear mold made of soft silicone, really things have come a long way since the olden days. As I mentioned, the appearance now, the form factor of hearing aids are much improved. And ultimately, patients must convince the hearing aid work for them and improve their hearing and their social interactions and overall quality of life. Sometimes they will still find that hearing aids may not be the best option for them. And really it's because hearing aids are fundamentally amplifiers. So sometimes they also amplify noise. Sometimes they undergo a bit of distortion if the fitting is no good. And occasionally, depending on the model of hearing aids people use, they may get more noise than conversations. So all these needs to be tuned by experienced qualified audiologists, and a lot of the problems can be solved if hearing aids are properly programmed. So when do I normally recommend a hearing aid for patients? And really, I tell them it is from their own experience and their learning, rather their hearing needs. So when they have problems hearing in noisy places, when there are multiple talkers speaking at the same time, or in very open spaces, it is a strong indication that they may need hearing aid. And when hearing loss is affecting their quality of lives and their daily conversations and daily activities, it is time to consider hearing aid. And of course, a lot of patients with hearing problems feel very tired at the end of the day because they've been straining to hear. So they have a lot of stress and fatigue. It is really a serious indication for them to get some hearing aids. And finally, of course, people around them are also starting to get stressed about their hearing. For example, in elderly people, when they stay with their children and their children are stressed talking to them, call them over the phone, and they keep repeating themselves, it's really a time to consider hearing aids. And I think this is something that I like to show my patients. I think when you have enough need for hearing, it is time to consider hearing aids, especially bilaterally. And you can see from this photograph that if you don't look closely, you may not notice that our senior minister has hearing aids both ears. So that is almost a very compelling picture to show some of the patients who are very hesitant. So there are some occasions where hearing aids, no matter how much you tune it, it becomes no longer useful. And you have to ask yourselves whether the hearing has become so bad that hearing aids no longer can improve your hearing. And it may be time to think about new technologies that have come around in the form of hearing implants. And hearing implants, to be honest, are not new. They have been around for almost a decade, more than a decade actually. And the advance in technology for implants has been such that whatever kind of hearing loss, no matter how severe, what's the cause of hearing loss, there will be a hearing implant suitable for the patient when hearing aids are no longer useful. So it may take the form of what we call bone-anchored hearing aids, and we go through some of these in pictorial form, or middle ear implants, or cochlear implants. But it's important, these implants only work if the hearing nerve is working. And by and large, most patients, the hearing loss is, as I mentioned, is in the cochlea, and it's got to do with the hair cells, but the hearing nerve remain intact and functional. So by and large, implants are still suitable for patients when hearing aids are no longer working. So let's talk quickly about some of the implants. So bone conduction implants have been around for, like I said, more than 20 years. Very good outcome for people with what we call conductive hearing loss. That means there's something wrong with their external ear or middle ear. And it takes various forms. It basically is connected to the bone, the skull, and when sound comes in, it vibrates the bone. It bypasses the eardrum and the middle ear for the patient to hear. And of course, there are also some less obtrusive bone-anchored implants. The new implants are getting more and more aesthetically pleasing. So the Osia 2, which just been launched in Singapore last year, is the newest bone conduction implant that helps patients with conductive and mixed hearing loss. Now, of course, when patients have problems with hearing bones, or what we call the ossicles, there's a middle ear implant that may be suitable. You can see from this picture, this implant is attached to the hearing bones and it moves the hearing bones more, almost like a natural amplifier. And patients prefer this compared to the hearing aid because it sounds more natural to them. And there's a situation in some patients when hearing loss is so bad that hearing loss aids are no longer useful, as I mentioned. When you have zero hearing, as you can see from these audiograms, when you test, the audiologists cannot even get a response. We call it severe, profound hearing loss. In the past, people used to say, oh, this patient is deaf. But essentially, this patient has profound hearing loss. And of course, the days before cochlear implant, there's really no option for this patient. A cochlear implant now is such a miraculous device, can restore hearing in people who are totally unable to hear. And a cochlear implant has two components, one implanted under the skin and the other one that's worn outside. And patients always ask me, Do I need to keep changing this implant? And the answer is the part that needs to be upgraded really is only the external part. The part that's implanted stays with the patient forever. And the part that runs on battery is also the external part. So the part that's implanted the brain under the skin directly stimulates the hearing nerve to replace the hearing organ. And it used to be very big, used to be, of course, very obvious. But as the years have gone by, the implants that's worn on the outside, the component has got smaller and smaller, and it no longer hang on the ear anymore. It's just a little receiver that you can hide in the hair, especially for those with long hair or pregnant ladies. So the current indication for cochlear implants in patients is really when you have severe, profound hearing loss in one or both ears, and you have difficulty with hearing, especially in noisy environments, and the hearing aids are not providing enough benefit, and the patient is motivated to restore hearing and committed to retraining. And the reason is because when there is a certain amount of time here, the ear is not hearing, as I mentioned, the brain gets understimulated, and after a while, it tends to become lazy. So it needs to be stimulated again and retrained for the patient to hear again. So if the patient is motivated, committed, they become very good cochlear implant users, and they can listen and hear just like you and I. And of course, not surprisingly, patients who have received cochlear implantation, especially in the older population, actually again have positive impact on their cognitive function. So whether it's hearing aids, whether it's hearing implants, studies have shown time and again that cognitive benefits are generally positive in people who undertake these interventions. Of course, patients' main concern is, if I undergo this surgery, is it scary? Is it painful? Is it risky? And the fact is, in experienced hands, the risk of cochlear implant surgery is very, very low. You can see from this table, it's really an aggregation of global data. The risk, or rather the serious risk, are mainly through the wound and all that. And even then, the incidence is extremely low, in the region of 10, 12%. And we're talking about global data. So generally, cochlear implantation is very low risk. So for me, my surgery takes about 2 to 2.5 hours. Patient usually go home on the same day. It's a day surgical procedure. Of course, some patients want to stay overnight. That's fine. They go home, or they will have a head bandage overnight, and they get their stitches removed in 1 week, and the implants get activated at about 3 weeks to a month. And then they will fly if they are committed to their retraining, as we mentioned. And I can assure you there's really minimal pain for the surgery. Of course, the million-dollar question is, how much does a cochlear implant surgery cost? And I can assure you that most of the cost of the implant is covered by Medisave, Medishield, and insurance. So for people who are not covered, the cost of the implant would be in the region of $45,000 to $50,000. But for people who are covered, you can see from this bill from one of my patients, they end up paying nothing. So all these the costs largely covered. So there is really no reason, as I tell my patient, to suffer in silence. You have significant hearing loss, so go for a hearing aid. And if hearing aid is not functioning or working to the best of your needs, then an implant will not be a very big barrier. So I'm going to conclude here, and really to recap what we talked about. Let's all be advocate for hearing health. You will tell your friends, your family members, colleagues that hearing is an important part of health. Go for hearing screen some point as part of your health screening, because hearing impacts your quality of life, and if left untreated, it will affect your brain health, and it can lead to early cognitive decline, onset of dementia. It is also related to increased mortality from different causes. And there are very simple ways to improve or restore hearing in the form of hearing aids. And if hearing aids are not working very well, then implants will help most patients. And therefore, we should really prevent hearing loss, get ourselves diagnosed early, and get it treated as soon as we can. So with that, I thank you very much, and I leave some time for any questions from floor.
Okay, Dr. Yuan, thank you so much for your sharing. So yeah, we have some time for questions, and I'll be moderating the questions. So maybe we have about 15-20 minutes for questions. We should end by 9 p.m. Okay, so first question comes from CH Ong, and the question is, any recommendations where to get hearing aids? Dr. Yuan, could you share your thoughts on this?
So hearing aids are actually available in most of the public hospitals, and also in quite a lot of private hearing centers. So once you get a hearing test done and you're diagnosed to have some degree of hearing loss or hearing problems, you can always get a hearing aid fitted at one of the public hospitals or private hospitals or one of the private hearing centers. So there are also patients who ask me, can I just buy hearing aids from Mustafa? So I generally don't recommend, because then you have no one to program your hearing aids. And generally, with due respect to Mustafa, the hearing aids that are being sold off the counter, if there is no one that is sort of associated with that outlet that can tune your hearing aids, then generally it's just like buying glasses from NTUC. So you don't know whether that's suitable for you or not. So generally not recommended to just walk into a shop and buy, unless that shop has someone to take care of your hearing aids for you.
Okay, thank you. Okay, next question. Assessed to have vestibular disorder, but hearing test is normal. What are the likely reasons?
Wow, this is a question that I might be able to take half an hour to answer.
Wow.
Because as you know, our inner ear, on top of just being responsible for hearing, there's also a part that's responsible for balance. So inner ear balance is known as vestibular. So vestibular disorders is essentially related to the inner ear problems. And patients with vestibular disorders may be suffering from different conditions that affect the balance. So likely reasons are many. It's very hard to just postulate at this point. You probably need more assessment. So look for a experienced ENT person who has expertise in treating vestibular disorders. They will likely be able to help you.
Just out of curiosity, for myself, is like, what are the most common reasons for vestibular disorder?
So there are three conditions that are vestibular in origin that a lot of people suffer from. Number one is a condition known as BPPV, which are what normal people call crystals in the ear. So there are sort of stones or particles that have been dislodged in the inner ear and then go into a position where it is not supposed to be. So when a person moves or bend down or look up, the particles move in the inner ear and make them feel like, they're spinning. So that's BPPV. The second condition where you can have a balance problem with normal hearing really is what we call vestibular neuritis or neuronitis, which is really like an infection of the balance nerve. So that's number two, and that really takes a few days to get better. It's not as benign as BPPV. And the third condition that we see quite often is migraine vestibulopathy, or what we call vestibular migraine. So a lot of people with history of migraine also have a history of imbalance or spinning. And quite often when we treat the migraine properly, the vestibular problem goes away. So these are the main three conditions. And of course, there are others that I commonly see in my practice. But like I said, it might take too long to go through them.
Okay, thank you. Okay, next question. Hi, Dr. Yuan. Is it advisable to clean the earwax ourselves regularly?
I love this question. In all the webinars and talks that I give, it's invariable question. So, and the short answer is no. And the reason is because our ear is built to clean itself. A lot of times when I tell my patients that, they look at me in disbelief, But the ear canal actually has a mechanism where the skin actually continuously migrate outwards. And if you just touch your ear canal and you can feel that it's a little bit oily. And a lot of times it's because the wax and secretions from the skin glands and all that from our ear canal has been pushed out. And so if we don't disrupt it with cotton buds and all that, or we don't disrupt it by having an infection because we went swimming and didn't dry our ears and all that, this mechanism actually works very well. So you don't have to use a cotton bud to pick at it. And in fact, a lot of times we see patients injuring the ear and infection sets in because they're trying to clean their ears. So the short answer is no. You should not be cleaning your ears regularly, especially with a cotton bud.
Okay, thank you. Okay, another question. How can we get our hearing assessed?
Okay, so again, let's not similar to the first question. There are various ways. Number one, you can ask for a hearing test as part of your hearing screen, and that can be at the family physician clinic, a health screening center. Second is to go to a public hospital and ask for a hearing test to be done, or go to a private hospital to get a hearing test to be done. And finally, to go to one of those private hearing centers where they sell hearing aids, get the hearing test done. Yeah.
Okay. Just out of curiosity, how much is a hearing test? Hearing test going to cost? This one is from me, yeah.
Varies. So the private hearing centers will tell you can get a free hearing test. Of course, it's free when you buy a hearing aid. Just like glasses, right? If you get a pair of glasses, your hearing test, your eye test is free. But generally in private or public hospitals, the cost is in the region of about $80 to $100.
Yeah, that sounds quite reasonable. Okay, next question. Is there a recommended hearing loss level that you will start recommending hearing aids? This person says, I can still hear normally sometimes. I can still hear normally, but sometimes when not focusing, will not be able to hear clearly.
Yeah, so Charlie, very good question. As I mentioned, usually I don't tell the patient, oh, you cross this level, you need a hearing aid. No, because just like your experience, sometimes person A may have this hearing and then cannot hear very well. Person B may have the same hearing, but they're functioning very well. So if you find that you're not able to hear and it's affecting your quality of life and your work, social interaction and all that, then it is time to try a hearing aid, see whether that improves all your symptoms. Yeah, so there's no specific number.
Okay. And okay, maybe as a follow-up to the previous question is about hearing tests, right? Would you recommend that like be done yearly, or is there an age whereby like after a certain age you should do it yearly or every 5 years or something like that? Yeah,
Very
I've
good
always
question.
wondered. Yeah.
Yeah. So we do recommend a person who is 60 years and above, because we know anybody who is 60 years and above, as far as the Singapore population is concerned, if 2 out of 3 people may have some kind of hearing loss. So if you're 60 years and above, do check your hearing yearly, at least. If you are younger than 60, then you may want to at least have a baseline hearing test done uh, as part of health screening. And if it is normal, then you can wait till 60 before you do the yearly test, if it's normal. Yeah.
Okay. Then another question is it good to use olive oil to wash ear? Well, you did say is normally you wouldn't recommend washing ear, but maybe would like to hear your thoughts on olive oil.
I wouldn't say wash, but olive oil is very good for people who have recurring problems with earwax. So we have people who have a lot of earwax buildup, and we do recommend that they put 2 or 3 drops of olive oil regularly, like 2 or 3 times a week, just to prevent this earwax from drying out and really clogging the ear canal. So not to wash, of course, wash, obviously you need a large amount. It's going to be messy. But 2 to 3 drops regularly is a good idea.
Thank you. Okay, another question. How to prevent ear infection after swimming?
Very good question and very important. So, Yvonne, the way to prevent ear infection, really, if you ask me, is to wear 2 things, earplugs and a swimming cap. So there are what we call swim plugs for people who, for example, swim regularly, they are competitive swimmers and all that. We can make customized earplugs that fit into every nook and cranny of your ear, so that water is totally prevented from getting into the ear canal. So that's one. But for normal people who are leisure swimmers and all that, you can just use a normal hearing earplug, and then, if possible, wear a swim cap if you have problems with having water getting into the ear, because some people's ear canals are really quite prone to trapping water. Yeah. So it is a real problem.
Okay, another question. Is there any way to delay hearing loss, say for example, eating certain foods or something like that? Yeah.
Well, Ray, the short answer is no. I don't think there has been any proof or evidence that food, any kind of food, is related to hearing preservation or delaying hearing loss. I know for vision and eyesight, a lot of people say you can eat goji berry, but even then, I'm not sure about the scientific evidence. So for hearing, unfortunately, no special food that can help to prevent or delay hearing loss.
Okay, thank you. All right. Well, we're seeing if there's any more questions. Maybe I have a couple more of my own here. So, Dr. Yen, hearing is probably the second most important sense, right? If I recall correctly, the first one being vision.
Yes, I'm biased. Of course, I want to say that hearing is number one. But yes, I think in terms of the importance that people put on our senses, they tend to put vision above hearing. Yes, and I think that's reasonable. But the truth is, if a person goes blind, there is no way to restore vision. But if a person goes deaf, we have something that can restore hearing. So it is quite amazing to me, in a sense.
Okay, that's cool. I didn't know you can restore hearing if you like go deaf. Honestly, I just learned something new today. Another question says, okay, Eng asks, I often feel my ear like having pressure, like on the plane. I need to blow my nose to get the ear pressure out. Is it normal?
No, it's not normal. Most people with that kind of symptoms uh, means that they may have a problem with what we call the eustachian tube. Uh, there's a connection between the ear and the nose known as the eustachian tube, and it serves to sort of equalize pressure between the middle ear and the nose, which more or less is equalize pressure between the ear and the external environment. So most people, especially if they have what we call allergic rhinitis, so they have congestion, they have blocked nose, they have sneezing, they have runny nose frequently, they tend to get problems with eustachian tube function, and they get all this ear blockage because the pressure cannot be equalized. It's almost like you take a plane and you're perpetually on a plane, you cannot equalize the pressure. There's like it's a balloon, you know, that you cannot sort of release. And as this person mentioned, Jay say sometimes you have to blow your nose to pop the ears. And when you do that, you're basically forcing air and opening the eustachian tube so that then the pressure finally gets equalized. And so it is not a normal situation. And if it keeps happening, you really need to get someone to have a look, because with time, if the eustachian tube is always not working, what happens is when the pressure cannot be equalized, then the eardrums get drawn in. You know, it's like gets sucked in from the negative pressure. Initially, it feels positive, but after a while, it becomes negative. And we see a lot of patients with what we call eardrum collapse. So instead of being a tight drum, the drum becomes very floppy, and they have hearing loss. They start to have more and more ear blockage. So it can be a significant problem. So yeah, if it keeps happening, please see somebody.
Okay, as a follow-up to that question, because normally when I take a plane and I don't have to blow my nose, but I just need to yawn a bit and then it kind of equalizes. That's okay, right?
Yes, so if it equalizes and it stays equalized, you
By
have no
yawning,
symptom, that's
yeah.
fine. Yeah.
Oh,
But
okay,
if
okay.
it persists and it keeps coming back, even though you're not on a plane, that is something to be concerned about.
Right. Okay. I guess that's why sometimes when plane takes off, you might hear infants crying because I think they do not know how to equalize the pressure. I guess it's
Yes,
something to do with that. Right.
absolutely right. Yeah.
Okay. Okay. Smaller question. Where should I go for consultation on this, please? Dr. Yan, maybe? Okay. Ng, I would recommend you seek professional medical advice, but maybe Dr. Yan can share his contact later if you'd like to speak to him. But I'm really not qualified on this lah. But if you want to check this thing out, yeah, well, we have Dr. Yan here. Okay. Any other questions from the audience? I mean, it is rare to get a ENT specialist with what 25, 30 years of experience now to come and speak to us on this and answer any of your burning questions. Anyone else has questions? If for Dr. Yan, we'll just uh leave the floor open for another few minutes. You can type your questions about what while we're waiting for any other questions. Okay, Dr. Yan, just want to ask like just out of curiosity lah, what's the most uh I guess you do surgery, but like what kind of incredible things have you experienced? It's just out of surgery. I know you have mentioned before, like you found really odd things that were stuck in patients' ears. You have any stories to share, perhaps?
Yes. Well, to me, it might be interesting, but to a lot of people, it's very queasy lah. So the most interesting things that always sort of intrigue me is insect in the ear. And I've seen my fair share of cockroaches, flies, and there was once, I remember very distinctly, some patient came to me after trekking in some forest in South America. And he began to feel that there's something funny in his ear. You know, whenever he shake his head, it's like something moving. So when he came to see me and I looked in the ear, I was actually quite surprised. There was a little plant growing in there. So
Plant.
actually, as he went through the, yeah, actually, I think when he bashed through the bushes, some seed must have got lodged in the ear canal, and it started to germinate in his ear canal. So for those who are interested, I have posted that picture in my Instagram. My handle is the same as my name. You can have a look at it. It's such an amazing picture because the plant was really growing in his ear. So that
Wow.
actually left an impression on me.
But it can be removed, right? The plant.
Well, yeah,
Surgery.
we move it for him, yes.
But I didn't know a ear canal is really an environment where a plant can grow.
Yeah, it's moist, it's you know, it's good,
Okay.
good for plants.
That's,
That's why you
that's
get
very
fungus in the ear and all that.
okay. All right, we got a bunch more questions coming in. Poon asks, I can hear normally, but could not hear anything during a functional hearing test. How come?
Very good question, Poon. So a normal hearing test, what they do is they play what we call pure tones. So there is a sound, there's a tone, and you're supposed to respond by pressing a button to see at what frequency, at what level you can hear. But when you talk about functional hearing test, it means that they making you listen to words, syllables, and so on. So you may be able to hear sound, but when it comes to conversation and words, you're having difficulty. That means you may have some degree of processing issues. That means the sound when combined, it's sort of become jumbled or gobbled, and then you cannot sort of decipher. So there are things like speech testing that can be done that may give further clue to what the problem is. So if you consistently have problems with functional hearing tests, but is doing well in usual hearing tests, please seek professional attention. Yeah.
Charlie asks, what is the range of mid to high-end hearing aid costs?
Charlie, it really depends on what you mean by mid to high end. So for me, I talk about the functionality of the hearing aids. So it's just like an iPhone. The more function you want, the more it costs. And of course, if your hearing is more severe, then you need a more powerful hearing aid. I'm not sure whether you consider that high end, but essentially, if you need more out of a hearing aid, it costs more. So the most expensive hearing aid is in the region of about 15 to 17,000 for a pair. Yeah.
Okay, that's interesting to know. Okay, Poon also added a comment saying he could not hear anything or silence. Poon, I assume this is during your functional hearing test. Absolutely cannot hear anything. Okay. Okay. We're almost nine, coming to nine. I'll end at nine, but while any of you are thinking of any last questions for our guest tonight, maybe what I can do is I will share Dr. Yan's profile, which is coming out on the screen now. I just take it straight from his practice. Dr. Yan can see your own profile. It's up there. Yeah.
Yes.
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 Okay. So this is Dr. Yan's profile. And of course, if you all wish to speak with him on any hearing issues, his clinic is there. Ear, nose, throat, neck, head and neck surgery, and of course, you can find him at his clinic at what was it, Mount Elizabeth Orchard. At the same time, oh, okay, wait, I think there's one more question. Okay, question says, okay, Dr. Yan, this one is for you, of course. For those who use hearing aids, what are the things to watch out for? As my mother finds that the surrounding noise gets enlarged when she uses the hearing aid, is this normal?
Yes and no. I think quite a lot of times when a person has quite significant hearing loss, which I'm assuming your mother has, from what you say, it is very hard to what we call selectively amplify noise versus conversation. So when a person requires that degree of amplification, is inevitable that noise gets amplified at the same time. So it is not normal, but like I said, for a person with very severe hearing loss, that may actually be part of the phenomenon. So if it is a new phenomenon, please go back to the audiologist who has fitted the hearing aid and see if they can tune out the noise. If not, then you might need to upgrade to one with, for example, noise cancellation and all those other new technologies. Yeah, assuming your mother doesn't have that already. Yeah.
Okay. Just a question for myself as well. Okay, between over-ear headphones and in-ear earphones, right? Do you have any thoughts on which one might be better in the long run to preserve your hearing?
Actually, they are the same. No,
They're the
no
same.
significant difference. No.
Even if it's in your ear versus over your ear, this
Yeah.
is
The only difference is there are some talks about noise cancelling headphones. Because when you have noise cancelling, either over your ear or in the ear, you tend to end up turning up the volume. And with long-term use, of course, there's always a risk that that can have some impact on the hearing.
Okay. And another question from me also about local context. It's been reported the Thomson East Coast line is very noisy. I'm not sure you've seen that, Dr. Yen, but they I wrote on the Thomson East Coast line. Some part is like there's this really loud screeching sound. So having said that, like, would you recommend like even just wearing earphones that or something just to prevent the noise from affecting your ear, just when you're riding the train underground?
It's very interesting you mentioned. Actually, I sometimes take the Thomson East Coast line, and there was once, nowadays our iPhone has a audiometer, or decimeter. So when I tested, it was almost 80 decibel, which
That's
is
considered loud.
which is loud. Which is loud.
Okay.
So 80 decibel is as loud as you walk past a construction site and they are doing that drilling on the ground.
Yep.
That kind of volume.
Right.
But thankfully, not the whole Thomson East Coast line has that problem.
Yeah,
as
it's
I
not
mentioned, there is a certain stretch. Yes.
Yes.
And at 80 decibel, the exposure, if it is transient, has no significant impact on our hearing.
Okay.
So yeah, don't have to wear earplugs in MRT.
Okay. I'm not getting that problem of downtown line, but yeah, sometimes when I take those East Coast line, yeah, I can't remember where, but some stations, it's like this really loud screeching sound. So
if I'm not wrong, it's between Tanjong Rhu and Marine Parade.
Okay. Can. All right. Okay, and we are almost 9 o'clock. I will just see if there's any last question from any one of you. It has been very enlightening, especially when it came to the Q&A. There's really a lot of interesting questions and a lot of insights shared by Dr. Yen. Any last questions from anyone at all? Any last questions at all? If not, I will have one last question of my own. So, Doctor, you said deafness can be reversed. You mentioned something like that, right? So when you say it can be reversed, as in like that's probably through surgical means and they install something. So how does that work? If you give a
so
brief.
I was talking in particular during my sharing about cochlear implant.
Yes.
So the cochlear implant is the only device that can restore a person's senses. We have 5 senses.
Yes.
And none of the senses beside hearing can be restored. You can't restore touch, you can't restore taste, you can't restore vision, and you can't restore smell. You can only restore hearing. So it's such an amazing device. And of course, the person has to want to get the hearing back.
Okay, got it. Okay, nice couple of last few questions coming in. Any adverse effect of wearing noise cancelling headphones? I think you briefly mentioned about like people tend to up the volume a bit louder. But any other adverse effects that you can think of to share?
No, not really.
Not really.
Not really. Yeah.
Okay, that's good. Another question says, when there's renovation in upstairs unit is very noisy, how can you protect your hearing?
The easiest way is to get earplugs.
Just normal earplugs.
Yeah.
Okay, cool.
Yeah. And
All right.
yeah, talk to the neighbor.
Okay. Okay. All right. It's 9 o'clock. If there are any more questions, I guess while I'm wrapping up, you can send one last question across. If not, I would like to thank Dr. Yuan for his time tonight and of answering all the questions that all of you have. I think it has been very insightful to listen, especially when it comes to like real world examples of things happening. I think especially the plant in the ear, I'm not going to forget that anytime soon. Okay, so for those of you who need any professional medical advice, please seek, especially relates to hearing, please seek a professional for this lah. With that, I think okay. This is a good question. I think where to get good earplugs. I think that's a good question because even I don't know whether a earplug is good or not. I mean, I think I have some next to my desk actually, but yeah, it's a good question. Okay, wait, let me see. I can show the earplug. I'm not sure whether you saw that. Yeah, I got this at the event, but it feels very flimsy. I don't even know if this is considered good. So, do you have any tips to share about good earplugs?
So, there are earplugs that allow you to be able to hear your own breathing. Those are good earplugs.
Oh, so that's your baseline for a good earplug, that you plug in, you can hear your own breathing.
Yes, and even when you put on your own earplug, that is what you want to achieve. Because that means there's a good fit.
Okay.
There are no specific brands that I can think of, but if you want to include sound, the silicone ones are good. There are some silicones one that fit very well in the ear canal. I can't remember the brand. I think it's called Max or something like that. But if you're looking for a earplug that prevent water from getting into the ear, I mentioned those that needs to be customized to your ear. So it depends on what function you want. Yeah.
Okay. Great. Okay, I think that was actually a pretty good question. If I didn't think of it, so thanks Poon for asking that question as well. Yeah, I always wonder what's considered good for earplug. Okay, I guess there are no more questions. And I'd like to thank Dr. Yan for his time tonight. I'm just going to stop the share now.
Yep.
So,
thanks, Elijah.
Yeah,
and
thanks everyone for coming. As always, stay safe and hopefully yeah, we will have more panel experts like Dr. Yan in coming sessions. We're always trying our best to add value to the community here. So if there are no more questions for Dr. Yan, okay, thanks everyone. I will end the session now, and stay safe and have a good weekend ahead.
Thank you.
Thank
you,
you.
Elijah. Thank you.
Welcome. Thank you. Thanks for coming, everyone. Good night.
Bye-bye.
Recording stopped.